Hi, this is Shaherbano, and today I will be talking about the empty chair technique and unfinished business. In Gestalt, the empty chair technique is a very unique, impactful, and iconic tool for the therapist. It's a Gestalt intervention where feelings and unresolved issues, which we may also call unfinished business, are projected onto the empty chair by imagining a significant person or a part of them is sitting on that empty chair. This method externalizes internal conflicts and brings unresolved emotions into the here and now. This person can be someone from their past or present, alive or dead, and the client can talk to them and express their emotions and feelings which they could not or cannot speak in reality. They can also talk to themselves or a part of themselves, for example, their inner child who's afraid of failure due to conditions of birth. It can provide closure to grief. For example, a widow could not mourn her husband as her children were young and she wanted to be strong for them and not show them her emotions and wanted to protect them. An individual can speak to their deceased parent who was very controlling and caused trauma to them in their childhood, which lives on with them in their adult life and requires resolution, or they can address their younger self to process this trauma. Similarly, people can address their inner critic and resolve deep rooted issues.
So now let's talk about the core principles of the empty chair technique. So at the heart of the empty chair technique, there lies the four core principles that make it so transformative and the unique sort of therapy. The first of these principles is the here and now awareness. Unlike the traditional talk therapy, we don't just discuss the past, rather than we bring it into the room, allowing clients to experience emotions as they arise in this moment. The next principle is the principle of direct dialogue. Here, the client doesn't just talk about their pain, they speak directly to it. Whether it may be a person, it may be a memory, or even a part of themselves that have been avoiding. This shift from narration to confrontation is where the healing begins. The third principle is the responsibility and choice. Many clients feel trapped by their past, but in this space, that is the empty chair technique, while they are doing it, they reclaim this agency. They're voicing the unmet needs, they are setting the boundaries or speaking truths they have long silenced. And finally, here comes the fourth principle that is known as the integration. The goal of the empty chair technique isn't just the emotional release, it's weaving these new insights into their daily lives. Together, these four principles turn abstract pain into the tangible growth. Okay, so let's see the potential applications and the benefits of applying the empty chair technique in the psychotherapy. So we can use the empty chair technique during the grief work with the client who can sit across from someone they have lost, not just to say the goodbyes, but to say what was left unsaid. We can use it for the resolution of the conflicts so that the client can practice the difficult conversations in a safe space, rehearsing the boundaries or the apologies. Similarly, we can use it during the role plays for the client so that they might dialogue with a younger version of themselves, offering the compassion they once needed. The therapeutic benefits of using the empty chair techniques go even deeper. Beyond immediate emotional relief, clients often experience a profound increase in self awareness. For example, someone stuck in anger toward a parent might, through this dialogue, uncover layers of grief or longing beneath the surface. And relationally, they learn to express vulnerability in a structured way. It can be a skill that often transforms their real world relationships. So, empty chair technique isn't just about revisiting the past, it's about rewriting its impact on the present. So, with many potential benefits and the potential uses, here comes the challenges while applying the empty chair technique. The role of the therapist to address these challenges is very paramount. None of that happens without the careful guidance of the therapist. As therapist, our first priority is the emotional safety. The empty chair can unearth intense feelings, so we are constantly attuned. We are ready to pause, to ground, or reframe if the moment becomes overwhelming. Being the therapist, our role is also one of guided facilitation. We ask questions like, What do you feel when you see them there, rather than scripting the dialogue? This keeps the process client centered and authentic. But it's not without challenges. While that is, maintaining focus is the key. When emotions run high, clients might deflect or they might shut down. So, in this scenario, our job would be to gently steer them back, helping them stay present with their discomfort. And perhaps more crucially, we support the integration. After a powerful dialogue, we might ask, how will you carry this insight into your week? Because true healing isn't confined to the therapy room, it's what happens when after the chair is empty again.
Now, let's take a closer look at some of the limitations and criticisms of the empty chair technique. While it can be a powerful therapeutic tool, it's not suitable for everyone. For clients dealing with severe trauma or disassociation, the intensity of the exercise can feel overwhelming or destabilizing. That's why readiness is essential. Therapists need to ensure that the client has a certain level of emotional safety and grounding before engaging in this technique. Another concern is the risk of re traumatization. If the process is not carefully guided, the client may relive distressing emotions without adequate support. This can lead to more emotional harm than healing. This is why the therapist's judgment is so important. Knowing when to pause, when to stop, and when to step in if the client becomes emotionally flooded. Some clients may also find the technique to be artificial or awkward, especially in the early stages of therapy. Since it relies so heavily on imagination and role play, it may feel too abstract or forced, particularly for clients who are more reserved or analytical. In terms of research, the technique has been criticized for lacking strong empirical backing, especially when compared to more structured outcomes such as CBT therapy. Its effectiveness depends heavily on the skills of the therapist, as well as the client's willingness to engage. It's not just about following a script, the therapist needs to be fully present and attuned to the client's emotional cues. Finally, there's the risk of the technique being misused or oversimplified, especially outside of formal therapeutic settings. Without proper training or supervision, it can lose its therapeutic value and even become harmful. So, while the empty chair technique can be deeply powerful, it is also a method that demands clinical care, proper timing, and ethical responsibility. To conclude, the empty chair technique remains one of the most distinctive and emotionally powerful tools in therapy. Unlike traditional talk therapy, this method doesn't involve discussing problems. It allows clients to engage directly with unresolved emotions, often by imagining a significant person or even a part of themselves sitting in the chair opposite them. This makes it especially useful in addressing unfinished business, which are those lingering emotional conflicts from the past that continue to influence a client's behavior, self image, or relationships in the present. Through this exercise, clients can experience emotional release, gain clarity, and often arrive at a place of self acceptance or closure. It facilitates what therapists call integration, which is bringing fragmented parts of the self back into wholeness. This technique can be applied to a wide range of issues, from grief and loss to internal self criticism to unresolved family conflict. And the beauty of it lies in its simplicity: a chair, a voice, and a safe space. That said, it is important to emphasize that while this method can be transformative, it must be used thoughtfully and ethically. This isn't a one size fits all approach. Success depends on factors like timing, client readiness, and especially the therapist's ability to guide the process with emotional attunement. In other words, the chair may be empty, but the work it represents is deep, personal, and often profound. So, to summarize, the empty chair technique offers a way for clients to stop carrying the weight of old stories and start speaking their truth in the present. Thank you very much.